Hi everyone, I'm Dr. Jessica Davis and welcome back to the channel. If you're new here, I'm a board-certified urologist with over 10 years of clinical experience helping men improve their performance, energy, and overall health naturally and safely. Today, we're going to have an honest conversation about a topic that many men over 50 find uncomfortable to talk about: your erections. I understand why this can feel awkward, but I promise you, what we're about to discuss could completely change the way you think about your body and your health. Too many men come into my office believing that weaker or less reliable erections are simply an unavoidable part of getting older. They think, well, this is just what happens after 50, and they accept it as their new normal. But that belief is not only wrong, it's dangerous. The truth is that in most cases, problems with firmness, consistency, or stamina are not purely about age. They are about daily habits, lifestyle, and hidden health factors that are absolutely within your control. The great news is that if you understand what's really happening inside your body, you can often restore your performance and confidence naturally, without pills or complicated treatments. Before we talk about solutions, I need you to understand something critical. An erection is not just a sexual event, it's a vascular event, a reflection of your cardiovascular health. The arteries that supply blood to your penis are some of the smallest in your entire body. If those tiny vessels start to narrow or clog, it's often a warning sign that the larger arteries leading to your heart and brain may also be at risk. That's why I tell every patient who develops erectile issues that this is not just about intimacy, it's about your life. Erectile dysfunction is often the earliest indicator of heart disease, appearing 5 to 10 years before a major cardiac event like a heart attack or stroke. So if you notice that things aren't the same as they used to be, slower response, softer firmness, or difficulty maintaining an erection, don't ignore it. This is your body's alarm system. When you dismiss those signs and say, "I'm just getting older," you might be missing a life-saving opportunity to catch a serious health issue early. The first and most important step is to see your doctor. Have your blood pressure, cholesterol, and blood sugar levels checked. Many times, improving those numbers can directly improve your erections because the underlying issue is circulation. I've seen men completely turn their situation around within months simply by treating early hypertension, high cholesterol, or prediabetes. Now, once you've ruled out major health risks, the next step is understanding what habits are silently damaging your performance every single day. The first major destroyer is smoking. Smoking remains the #1 cause of vascular damage worldwide, and it directly affects the arteries responsible for your erections. Every puff of tobacco introduces thousands of chemicals that stiffen and scar the inner lining of your blood vessels. When those vessels lose flexibility, blood flow decreases, and without proper blood flow, you simply can't achieve or maintain a firm erection. Quitting smoking is one of the most powerful immediate changes you can make for both your heart and your sexual health. Within weeks, circulation begins to improve, and the body starts repairing itself. Right after quitting smoking, the next step is movement. Physical inactivity is a silent killer of both energy and performance. Your blood vessels are like muscles. They need consistent activity to stay strong and responsive. When you live a sedentary life, your body produces less nitric oxide, the natural chemical that signals your blood vessels to relax and open up during arousal. Without it, that system fails. Regular cardiovascular exercise, whether brisk walking, cycling, or swimming, boosts nitric oxide production, enhances blood flow, and can literally reverse mild erectile dysfunction. Even 30 minutes of exercise 4 times a week can create measurable improvements in vascular health and testosterone levels. But exercise alone isn't enough. What you put into your body matters just as much. Diets high in saturated fats, processed foods, and refined sugar create a perfect storm for poor circulation. These foods raise bad cholesterol and cause plaque to form inside your arteries, including the delicate penile arteries. Over time, that buildup narrows the vessels, restricting blood flow and oxygen delivery. I recommend following a Mediterranean-style diet, rich in vegetables, fruits, whole grains, lean proteins, and healthy fats like olive oil and avocado. This style of eating reduces inflammation, supports hormone balance, and keeps your blood vessels flexible. One of the biggest contributors to performance decline is excess weight, particularly abdominal fat. That fat is hormonally active, meaning it releases inflammatory substances that lower testosterone and damage blood vessels. The result is a double hit: reduced hormone levels and impaired circulation. Losing even 5 to 10% of your body weight can significantly boost testosterone, improve energy, and enhance blood flow. I've seen countless men regain their confidence and vitality simply by losing the belly fat that was silently sabotaging their health. Another common misconception I hear from patients is that low sex drive or fatigue is just a normal part of getting older. That's not necessarily true. Declining testosterone can play a huge role in these changes, and while it's normal for levels to gradually decrease with age, sharp drops often indicate an underlying problem. Low testosterone affects not only libido, but also muscle mass, mood, and energy. If you suspect this might be happening, ask your doctor to check both total and free testosterone levels. In some cases, safe and monitored therapy can make a remarkable difference, but lifestyle changes like resistance training, better sleep, and stress reduction are also powerful natural boosters. Speaking of stress, mental health is one of the most underestimated factors in erectile health. Chronic stress, anxiety, and depression directly interfere with arousal. When your brain is in constant fight or flight mode, it floods your body with stress hormones that constrict blood vessels and block the neurological signals required for an erection. Performance anxiety alone can create a self-perpetuating cycle where worry leads to dysfunction, which leads to more worry. Addressing mental health through therapy, mindfulness, or simply better communication with your partner can have profound physical benefits. Now, let's talk about medications. Many commonly prescribed drugs, such as certain blood pressure pills, antidepressants, or prostate medications, can have erectile dysfunction as a side effect. This doesn't mean you should stop taking them, but it does mean you should talk openly with your doctor. There are often equally effective alternatives that don't impact sexual performance. I've had many patients regain normal function simply by adjusting their medication plans safely under medical supervision. And please, do not try to solve this issue with unregulated supplements or online enhancement pills. Many of these products contain hidden pharmaceutical ingredients in unknown doses, which can cause dangerous interactions or heart complications. I've personally seen patients hospitalized because of these pills. If you ever need medication support, do it safely under medical guidance with legitimate approved options only. Finally, let's address the physical health of the organ itself. Never ignore pain, curvature, or trauma. A painful bend in your erection can be an early sign of Peyronie's disease, which results from scar tissue forming inside the penis, often due to minor injury. Early treatment can prevent it from worsening. And if you ever experience sudden pain or swelling after trauma during sex, seek emergency care immediately. Quick intervention can prevent permanent damage. Gentlemen, I want you to remember this. Your erection is not just about performance. It's a reflection of your overall health. It's your body's way of communicating with you. When something changes, don't ignore it. The earlier you act, the more control you have over your future. By making smart, consistent changes, quitting smoking, exercising regularly, eating clean, managing stress, and having honest conversations with your doctor, you can dramatically improve not only your sexual health but your entire quality of life. I've seen men in their 60s and 70s regain full natural function simply by addressing these root causes. It's never too late. Your body has an incredible ability to heal when given the right conditions. So take this as your reminder. Age is not the end of your vitality. It's an opportunity to take charge of your health. If this video helped you understand your body better, please subscribe for more science-based practical guidance on men's health and hormone balance. I'm Dr. Jessica Davis, and I'll see you in the next video, where we'll talk about one powerful nighttime habit that can naturally support your testosterone and energy levels. Stay strong, stay healthy, and take care of yourself.